Hello, I'm excited to be back again today. Do you know that the NHS data is worth 9.4 billion per year? And the NHS benefits 5 billion per year and patients benefit 4.6 billion. You're wondering why I'm giving you these statistics, right? Relax. Go get a cup of tea or coffee, or juice, sit back, and we have a real serious conversation on healthcare and data. Da-da-dum, boom. Let's dive into this now. Data is an important, integral part of care. Most people don't know about it, but in this session, I will carefully and methodically take you through why data is very, very important and is a core aspect of care. So first, what is data? I'll try and stay very elementary in this session generally because I really want each person to understand the aim of doing this. And the aim of doing this is very simple. I want every care staff from the NHS to care home generally and wherever sector you are in to understand that data is life. Data will stand for you and data can stand against you. But I want you to know that data is life. Especially in the healthcare, data is king. In healthcare, data is king. So basically, within the our definition, we play around the healthcare system. Data is any information you collect from people, from patients, or for people living within the care system. Is the data you collect from them that has to do with their person, as it relates to their health, their finance, everything around them, their relationships. These are set of data that sums up the entire existence of the person. So if you have someone come into a care facility, there's something called onboarding. Within that onboarding session, you take the details of the person. Most times it's in center head anyway, but when the person comes, you verify and you allocate room, allocate space, and all of those. When you have an emergency, for example, your data is collected. Your name, your date of birth, your address, and all of those. Those things are vital because they help tailor responses that are person specific. Those words were used on purpose. They help to tailor what responses that are person specific. So therefore, it would be out of place for me to take Mr. A's data, use that data to attend to Mr. B. It will not be right and fit for that individual. So there is right data and there is wrong data. So let's continue. What is data? You know what is data now. Then why data? Why? Data is used. Why data? Data is used to help drive a narrative. It helps to build patterns or show patterns. It helps to direct an innovation, a research, and insights into illnesses, diagnoses, and the list continues. So data is really the heartbeat of care within the NHS, within any trust, and within any care home or any care facility. I'm going to be cascading down to how data matters a lot when it comes to you as a care staff. That's my cross today, and I'll do that as much as I can because I've come to see multiple times that care staff look at data and they don't understand the value, the essence, the meaning. So this is an attempt It's an attempt really, because you can't get it out. You can't let it out in just one goal. We need to continuously speak to it, address it, and push this narrative so that care staff will understand and in turn serve better, do better. Because the truth of the deal is, when data is wrongly presented, when data is wrongly interpreted, when data is wrongly recorded, everyone suffers from it. From the care staff to the individual or the patient down to the organization. The organization can get fined, the patient can lose his or her life, and the care staff can be in problem or in danger. So it cuts across everybody. So the place of data is really, really king. I've used multiple words for data today because data is really important. I've said data is king. I've said data is the heartbeat of care, because truly that's what it is. How to use data? We use data to analyze patterns. We use data to analyze patterns. Remember when we started, I told you that the NHS, the value of data to the NHS is what? 9.6 billion pounds per year. And that is 5 billion per year to NHS benefits and 4.6 billion pounds per year to patients' benefits. What does this mean? Researches are ongoing and they will continue till the end of time. COVID-19 came, gone, but the research is still ongoing, because tomorrow there may be another pandemic. How do we properly position ourselves so data are always gathered, analyzed, examined, cross-examined across different countries and continents sometimes, to just be able to prepare and to answer questions? Remember the time where we had Ebola? That was another ball game, and COVID-19 was no good to anybody. The world was shut down for approximately 2 years. In fact, some organizations have still not recovered from COVID. And thanks to COVID fairly, because we now understand the place of working from home more than we used to. So that has created another good aspect when it comes to employment, when it comes to working more effectively. Because sometimes you just spend loads of time on traffic that you'll be using to do the actual task while you are in your home. So thanks to COVID on that regard, but generally COVID did mess a lot of things up. So data is used to better manage, prepare for things like that. I don't want to see that happen in my time, in my generation, and within this world ever again. Sincerely and fairly, but it's not up to me, is it? So back to our conversation. In care homes, within the NHS, when you're running a shift, if you don't have a big screen, A1 system before you, you can have the phones or tablet, depending on the organization, or you have the books. What are these things for? They are for data gathering. Each hour, you write down what you have been doing, or what the patients have been doing, or what you and the patients have been doing within the last hour. If you work 12 hours shift, you will give account of those 12 hours within the big screen, the small screen, or your paper, or the booklet, whichever it is that they give to you. And depend on the home or depends on the organization, there are loads of things for you to reference or record. Depending on the kind of service that you are in, there are loads to record. So what you record per shift vary depending on the organization, depending on what they are interested in, depending on the condition of the individuals that are within that space or that you are actively working with. So for example, if you are working with an elderly person that has issues with mobility, then recording will be different because you'll be playing with things like repositioning every 30 minutes, every 15 minutes, depending on the integrity of the skin, right? Let's switch a bit. If someone, an elderly person that has issues with drinking, you'll be looking at fluid intake charts. If it's someone that has issue with bowel movement, you'll be having things like bowel movement chart because that's an issue. So most times you create record around the negative because those negative can impact the quality of life of that individual. So if the mobility is great, they'll not be asking you for mobility check. There's nothing to check in the mobility. But when the mobility is not great, that's when they ask you to give details of the mobility. Why? So they can monitor per time if there is a decline or there is an upgrade. You need to understand this. So when we keep record within the care system, we are not just keeping these records because we need to do something, we need to evidence our time working. No. In as much as that is correct, that's not the main gist of keeping those records. Is to ensure that we carefully monitor the quality of life of these individuals, and at the end of the day ensure that they are getting better. And if they are not, look for the necessary services or solutions or sister agencies or organizations to reach out to for support and for response. So for example, you're working within a care facility and the person you are supporting, again, I'll use mobility issue. The person you are supporting has issues with mobility. He or she needs is bedbound, is a nursing home, bedbound, and you need to reposition this person because of skin integrity to avoid bed sore. The person needs 30 minutes positioning. If you are a care staff and you just record repositioned either on the big screen or the small screen on your paper or your booklet, what you are simply doing is saying that I don't care what happens to you. And to be fair, you should not be in the space if you don't care what happens to the individual. And I don't need to remind you at this time that if the individual was fit enough to carry out these activities and these tasks, you will not be asked to do that. You won't even be in the same room, the same space in the first place. So it's because of these issues that's why you came in the first place. So if it's demanding, is not right for you, you can always resign, check out some other job. But if you are in the care system, if you are within the health system, your compassion should be with you 100%. Your compassion should be with you 100% because it's needed to ensure that the individual you are supporting is well and the quality of life, I keep using this word on purpose, the quality of life of the individual is amplified by you, not reduced. Within your 6-hour shift, within your 12-hour shift, or while the person is on A&E with you, the quality of life is amplified, not reduced. You need to ensure that that is your goal every time you go to work. Because sincerely, that is the reason why you are there. So back to data. We are still on data, right? That was just a little shift. Let's come back to the value of data as it relates to care, staff, and the people you support. And even the organization is a three-way street. Yes, it's a three-way street. So as a care staff, whenever these records are given to you, I will kindly ask that you go through each of them, understand what is required. If you flip the books and you say bowel movement chart, you say fluid intake, incontinence aid monitoring, you see, for example, maybe epilepsy, or you see what else now, you see skin integrity check, body map. This, understand that these data are unique, special, valuable to the individual first, and then to sister agencies, and then to the organization, and then to a bigger sphere that you may not know about. So let me paint a picture for you. Someone has skin integrity check because there is the possibility of bed sore, and they are getting their skin is already getting weak due to them being advanced in age. You worked 4 shifts per week. Accidentally, you work with this individual 3 times every time you are on shift. 3 into 4, that's 6 plus 6, 3 plus 3 is 6, 6 plus 6, 12. So it means that you've worked with the person 12 times. You will work with the person 12 times in a month. So within that month, because you are used to the job, you are used to the person, and you're used to the environment, you just take personal care or skin integrity check all through. That's 12 missed in a month. Before you know, the person, the skin has deteriorated, he or she has bed sore. You see that bed sore? When it's time for it to be treated, the books will be checked. And the reason why they are checking the book is not because they are looking for whose fault it is. They are looking at the books to see why there is bed sore. Because if this person has been on 30 minutes hourly check or 1 hour hourly check for repositioning, it should prevent this bed sore. So when they check your books and they say, okay, this person hourly check has not worked, what will they do? With that data that is wrong, with that data, the person will be treated, yeah? And they will review that timing to 15 minutes. What have you done? You have successfully introduced an infection, reduced the quality of life, stressed the entire chain, healthcare chain, just to increase your own task. Does that sound right? I don't think so. You were doing the hourly check 1 hour in your 12-hour shift 12 times. Just trying to paint a scenario. Now, you will be doing that same check that you didn't do, that cost whatever happened. You will now be doing it 15 minutes every time. So, my friend, it comes around. It comes around. It comes around. So anytime you have the opportunity to go on shift, just try. Is it demanding? I agree. It's totally demanding. It's stressful. I agree. But once you've taken the role and you've told yourself you are going to do it, just give it your best. Give it your best. Because one thing I can assure you is that you and I can't give life, but we can only sustain with the little things that we do here and there. Does that make sense? So, back to the picture I'm painting. Because you falsified the record, there was a bed sore, which affected the person you were caring for, but it has come back to you. You will now be doing your spot check every 15 minutes. That's more work on you. But let's assume you did everything rightly, there was still bed sore. You will still do the job anyway. But there is a difference. You will naturally improve the quality of life for that person. So this tells you that data is very important. So when we are recording anytime in any of our shifts, we need to record right. So let's say, for example, someone is going through difficult moments emotionally. He or she cannot regulate rightly, and you have to document those times within a mental care facility. You have to document those times. How well do you effectively document them so that the right intervention can be sorted for that individual? Because when you underreport is a problem. When you overreport is a problem. But it's even better you overreport because the solution can be sorted. But when you underreport, it's more of an issue because the patient or the individual will not get the right support that is needed for them to have a better life, a better quality of life. So data is very important when it comes to care. So when it comes to the organization, they can be liable, they can be sued. And I'll tell you one story. This lady was living within a care facility. She was quite advanced in age. She died, and the family came, saw the lady, and they sued the company. What happened? This was the gist. When the lady died, after the lady died, they didn't really clean her up. So the family came, saw how she was. Guess where the major issue was? Adenta. Yeah, the oral care was poor. That was the challenge. The oral care was poor. That was what they picked and took the company to court for. Flip the books, my friend. There was no evidence, substantial evidence, let me use that word. There were no substantial evidence that showed that care staffs, aftercare staffs, have been doing the right thing. They may be doing it. I'm not even here to judge. I don't even have that capacity. I'm not in that capacity to judge. I'm not here to judge you at any time. My task is to ensure you get better, is to encourage and support that you get better. So don't think it the wrong way, right? The data was not recorded. So the company had to pay, and they paid a lot for that. But imagine a scenario where the family took the company to court. The company brought out books from 2 years that she was in there, or for 1 year that she has been there, and documented staff after staff after staff that have shown within the record that dental care was carried out, or he or she refused dental care. Because they have the right to refuse. Though it's detrimental to their health, but fundamentally as an individual, they have the right to refuse. What do? You document. That's the value of the pen or the system, the big screen or a small screen. Document refusal or document approval. You, my friend, you are the main gist. That's why I kept you for last. You are the care staff. You are the most important for me in this contest. I value what you do each day. I have been there and I'm still there. I know what it means to be a care staff. I was there a while back. I understand what it means to be a care staff or to be a support staff. It takes a lot from you and it requires a lot from you. So it won't make any sense having contributed so much, having given yourself just a tiny little. It's tiny and it's little at the same time, right? Just something very, very tiny would just knock you off or set you on the wrong trajectory of your life. It shouldn't be. That's why I'm bringing this information to you, to show you the value of documentation. It is absolutely important. So, when you get in your next shift, look at the books, understand the books from the beginning to the end of it. Understand all the records that they want you to keep. Like I said earlier when we started this conversation, know that most times when they ask you to keep record, it's always about the negative. They are positive, but most times companies, organizations are big on the negative. Why? Because they are trying to prevent something negative from happening. Does that make sense? So, like I said earlier, I will just reiterate again. So, someone has issues with their bowels. They don't open every time or regularly. So, there is close monitoring in place for that person. So, they tell you there is a monitoring chart for that. There's a book for that. When you get hold of that book and you are supporting that individual, it is appropriate for you to ensure that within your shift, you document if there is a bowel movement or not before you go home. Why? That is an important, integral part of that person. If you don't document, you have just reduced the quality of life for that individual, for that moment, at that instance. Do you understand my point? So if you go around their books or their record, you understand why these things are there, then you begin to implement. What it will do for you is this. Like the story I painted, the negative story I painted. If, for example, you are among the care staff in that home that was sued for lack of oral care for the individual, the deceased individual, this is what will happen. Your record will show when you supported the person. Please, can you have your oral care done? No, I don't want. You wrote it. 7:20 a.m. I asked the person's name or initial, how you guys record within your service, is up to you. And refuse oral care. I will come back. Or within the hour, you ask the person like 4 times, 3 times. A and B was asked, was supported with oral care, but 4 times declined. If you do that, you are being justified. When the hammer is coming, it's not going to land on you. You did your job. 4 times within an hour, you took out your time to ensure that oral care was done, but the person declined 4 times. That's fantastic. If that happened over a long period of time, your organization will pick it up and start looking for other solutions. It's natural. Do you get my point? So, for example, bowel movement chart. The books are opened and your manager discovers, or your senior discovers, or someone discovers that bowel movement has not been recorded for 4 days. So how do you tell that the person has actually gone or had a bowel movement for 4 days? You see the risk that is involved. So it's quite a tricky area. So data is king. Ensure that you write extensively all you do with anybody you are supporting or you are caring for within your shift. All that you do. If you went out to have a nice time, you went out for recreational activity, if you can write everything in details, please put it down. It's never too much. It's never too much. We get tired, that's the truth, but it's never too much. So this is where you need, again, like I will always encourage you, this is where you need to upskill in 2025, upskill within your space. Because you need to understand how these things affect the quality of life, how they affect your quality of life as well. Because if it goes wrong, you are sacked, your quality of life has been affected as well. If your DBS is damaged, your quality of life, not just you now, even your family, is affected. Your relation and relatives, they are affected. Your friends, they are affected. So it is very important for you to consider all of this every time you are on shift. Data is really, really king. So for you to understand that data is king, it means also that you need to increase your understanding within the care system, within the healthcare space. So what level of understanding do you have? What level do you have? And what is it that you know you are lacking that you need? Is it something that you need to talk to your manager to provide? Or is it something you need to go and research and just simply Google and read? You don't need to do much. Just go online and read it up. Have an understanding of what it is, why it is there. So you have some monitoring sheets within the booklet or within the system that you don't understand. Go online and check. Ask your manager. So for example, if you are within a care system that has someone with cerebral palsy or someone with epilepsy, for example, what does it mean? How do you support these people better? You need to know. If you have someone that needs insulin injection every day, every morning or every evening, what does that mean to that individual? What can that individual eat and what can they not eat? If you notice that there's something called your other staff member say he or she room 21 needs puree, for example, what does that mean? You need to check what it means. Go online, Google, check, understand it, keep that knowledge. The truth is, the more knowledgeable you are within the care space, the more confident you will be in carrying out your task. That is why there is urgent need for you to develop yourself. Self-development is always important. So I beg you yet again to upskill. Pick up that new certification. Enroll for that new training. Ask your manager to fix the next training on ABC that you have identified that you need understanding around and upskill. Remember, it is data that is king, not what you think in your head or in your mind, not what you have in your heart, is what the data is saying. When you record right and it goes wrong for any reason, you have your evidence to show that this was what happened and this was it. There are cases where persons have left the organization 2-3 years down the line, they are giving them a call to ask them of something they wrote a while back. Yes, it does happen. So you need to document rightly so as to be able to interpret anytime and every time. Especially when the armor is coming, you will escape when you document rightly. So my friend, there is need for us to keep up the upgrading skill. We need to drive down the waiting list of the NHS. We need to ensure that less people go there. Remember, I did a series on 4 and 4 risk. We can actively prevent those 4 risks if we know how to use 4 support guidelines, if we know how to ensure that we do proper risk management, environmental awareness. We are very confident that if we understand these metrics and we do these things, we'll be able to drive down these numbers and we'll have a better healthcare system that is fit for purpose, less tension, less stress for everybody, and we'll all have better quality of life. Thank you every time for giving me the opportunity to express myself and also ensuring that you're having value for your time. Remember to subscribe, share, like, comment. I'll be here waiting to respond to as many questions that are available as possible. And remember, I'm doing a challenge. The challenge is to hear your amazing story from any part of the world. If you are within the healthcare system, you want me to share your story, contact me. Send me a DM under this um, video or any of my video that you are interested in it. We'll have a conversation. I need you to just send me 1 minute video or 30 seconds video, whatever it is that you can do, but maximum is 1 minute, telling me about yourself and the amazing work that you have done within the healthcare system. All I want to do is to showcase to the wider society that you are amazing, you are fantastic, and you are making much impact in the life of people that you come across. Thank you very much. Look forward to seeing you in our next episode. Thank you. Bye for now.